Governor Jared Polis wants us all to take drastic action to slow coronavirus cases in Colorado. Joining me now is CBS 4 medical editor Dr. Dave Hnida. And Dr. Dave, do you think more restrictions or even a shutdown will help to get things under control?
Boy, I don't think anybody really wants to even think about things like shutdowns or more restrictions, but you have to be very realistic about what's going on in terms of coronavirus, not just in Colorado, but everywhere. You know, we always use that term flattening the curve. You could forget about that right now because the trajectory we are on right now is basically straight up. If you look at it from a national picture, we just added 1 million new cases of COVID within a 10-day period, 1 million in 10 days. If you go back to the spring, it took us 3 months to get to the 1 million mark. So you can see how rapidly the spread is. Now, when you take a look at Colorado, what's happening in our state, we are beginning to worry about hospital bed shortages, ICU bed shortages. Right now, hospitals are working together in order to make sure that people are getting to the places where they need to be, meaning there is a system that is currently in place where patients are being transferred to different hospitals that do have capabilities to take care of them. The worry is that pretty soon there's not going to be any beds to transfer a patient to. And thirdly, we take a look at really where we are in terms of staffing. You got to remember, if there are people who need to staff an intensive care unit, they need to have intensive care training, and that goes for nursing staff as well as physicians alike. And then there is also the issue, too, of what is the health of the healthcare workers who are working to take care of you. We worry about the group of healthcare workers getting sick themselves as the numbers begin to skyrocket. So we really do have some major concerns here. So I think at this point in time, you have to take a look at the three basics that we keep on repeating, and they are more important than ever before, and that is wearing a mask, social distancing, as well as good hygiene and hand washing. To that, I think you need to add two more things. And the first is the recommendation that there really be limiting what your household is interacting with in terms of other households. In other words, no interaction with other households, no social gatherings, functions, dinners, and so on and so forth, because that can potentially increase the risk of COVID coming into your household. And the other thing is limiting your social encounters outside of the home. The more you go out, the more places you go, the more likely you are to be exposed to someone who has COVID. And right now, with the number of folks who have COVID in our state, they are going to places like grocery stores and work and so on and so forth. So the more places you go outside of the household, the more risk you have of developing or contracting COVID. So please follow the rules and let's see if we can just get through this at this point.
Yeah, a few extra points that are important to keep in mind right now. Switching gears, Keystone opened up for the season last week with a reservation system in place. A lot of people excited, but what do you think about skiing in the age of COVID?
Well, I think that's a good way of putting it. What is skiing in the age of COVID? It is different than skiing at other times. I think when you look at skiing and snowboarding, you know, as activities themselves, they're just fine. I mean, it's outdoors. You are in a situation now where the resort systems are using a reservation system. They're limiting the number of folks who are out on the slopes. They're taking precautions in terms of who's riding ski lifts and gondolas and so on and so forth. I think a bigger concern is actually what takes place off of the slopes themselves. I think that the idea of dining, hotels, and even the people who work at the resorts, these are the areas where we really need to take a look at where potentially it could be a problem with ski season and the spread of COVID. And finally, take a look at the number of out-of-state skiers who typically do come to Colorado for vacation and a ski trip. And they may not be used to the level of restrictions that we have in our state and how we are working to contain the spread of COVID. So I think, if you're a front range skier, you're heading up for the day, fortunately, probably the biggest issue you're going to have to deal with is traffic on I-70. Skiing itself should be good, but just be prepared for a different experience.
Great. And we know in the middle of coronavirus, it seems many people have forgotten flu season is here as well. What kind of flu activity are we seeing in Colorado so far?
Yeah, fortunately, the activity at this point is very low. Typically, we don't see a lot as we go into early November. And right now, cases in the state are not very high. The number of people visiting the doctor's office or going to the emergency room because of influenza is at a very, very low level. In fact, even lower than it was at the same time last year. Hospitalizations, there's been only 2. Most of the activity to this point has been pretty much contained to rural areas. If you then, though, look outside of Colorado, there are at least 12 other states, though, that do have increased activity of influenza. So even though we've got low activity now, we do not have zero activity. We have other states that have the potential to have visitors come to our state, either coming through DIA or coming in, once again, to ski, something along those lines. And so typically it is the holiday season, Thanksgiving, for example, where we do begin to see a spread of influenza. And I think it's really important to say that even though levels are low, they are not zero. Influenza is here. So the advice that you will hear today, as well as for the next several months, it's not too late to get your flu vaccine. Please do so.